Welcome to the Marketing Minute. I'm Becky Amble, and I'm going to share with you some more trend information. This is TrendWatch 4. I'm going to share some information with you about the medical community. In a normal year, 8 to 10 Americans visit the doctor. Most of them do it at least twice. And among people age 65 and older, the majority visit a doctor 4 or 5 times a year. This is from the National Center for Health Statistics. And overall, this information is from one of my favorite magazines for statistics, American Demographics. So Americans are skipping doctor visits, and you've seen that throughout the COVID time. Now it seems like we're getting back to a little bit of a normal situation, a little bit more normal. However, this spring, April and May, there were some statistics that I wanted to share with you. 42% of Americans said that they were concerned about going to the doctor because of the virus. That's according to a Gallup survey, and that was done in April. Another 41% are moderately concerned, and young adults are just as afraid about the virus as older adults, college students as much as non-college students or people, and rural people, country folk, are as much concerned as city residents. Now, 41% of Americans have delayed getting medical care in the earlier time frame, like April this year, according to a Census Bureau study again. That was done in the middle of May, so my guess is this reflects information in April. And that number of 41% of people delaying medical care is almost the same as the number who said they were concerned about getting the virus if they went to the doctor, and that number is 42%. There is very little variation from state to state. In fact, New York, that had the highest outbreak of the virus, 44% of people said they were not getting medical care, 38 in Texas, 41 in California, and Montana said 44% of people were not going to be getting medical care. Now, and if you follow the statistics at all, you know that Montana has hardly had any cases. And also, parents are keeping children home from doctor's visits and well-child visits. The number of vaccines given typically in April, according to New York Times, is about 50% less when it comes to measles, mumps, and rubella. And also, this is affecting the healthcare industry. People are not going to the doctor, as we said, and people are afraid to do that, and physicians and clinics are seeing their business decline as well. So 63% of healthcare businesses report that the virus has had a large negative impact on them, according again to Census Bureau research. And in May, 69% of healthcare businesses reported a decline in their operating revenues in the prior week, so that's back in May. 26% had to cut staff, and only about 1 in 4 healthcare businesses think their operations will return to normal within 3 months, which would be right around now. So I think you can see that that probably isn't happening. In the U.S. today, healthcare determines a lot of doctor visits, and people that are under 65 years of age, about 46% of those without health insurance did not go to the doctor in the past 12 months versus 17% of those who have insurance. And as people lose their jobs due to the virus pandemic, the number of Americans without health insurance could climb by as much as 34%, according to the Urban Institute. Now, this is not necessarily information that is designed to boost you up or depress you. It just is information that has been reported. And if you work in the healthcare field, you probably know this better than I do. And you can also see that some of these numbers are changing. We hope things will get back to normal sooner rather than later. And take a look at this information and see if it is something that you can use in your business, if it helps shed light on some things, or if you're downstream from any of this, possibly you're in a medical product company or supply company and it could be affecting your business. So take a look at this and see if it's something that you can use. Thanks.